Let me just talk about methods. We've already mentioned things like catheterization. Obviously, urine substitution is prohibited. Blood doping. That has been a big one among athletes in the last 10, 15, 20 years. Blood doping simply means either directly taking erythropoietin, which is a banned substance, or more commonly, taking your blood. Say an athlete has a unit of blood drawn from them, storing that blood. This is now prior to competition, storing that blood, and then having it re-injected back into them just before competition. That's essentially what is meant by blood doping. So they've got the red blood cells, and then they inject the red blood cells to enhance, to augment the level of RBCs to give them an edge, so to speak. Well, that's clearly prohibited. But now there's come to light a variation on that. And this has become somewhat controversial, especially when, what's his name, Michael Phelps admitted to doing this. And it's not illegal. It's not against the rules to use these low-pressure chambers. In fact, there are these chambers that are available, and in many cases, the athlete will sleep there, maybe 4 or 6 hours, and under low pressure, low oxygen tension, which would tend to build up your RBC level to compensate for the low oxygen level. So it's sort of like athletes who train at high altitudes, at where there's reduced oxygen levels, build up their RBC levels. Now, there's nothing wrong with that. It's not against the rules. If you want to go to Colorado or Denver or Mexico City or a higher altitude to boost up your RBC level prior to competition. That really is a form of blood doping in a sense, but it's not against the rules. And that has become rather controversial in the last few years. Okay. And gene doping. Trying to stay ahead of the curve, the international agencies that we'll mention later prohibit specifically gene doping. Now, what do we mean by gene doping? Well, we don't really know, although we can certainly surmise what could happen. And in fact, there was a case prior to one of the Olympics, I can't remember which year it was, where somebody, a trainer I guess it was accused of using a gene transfer vector, or trying to use a gene transfer vector to administer it to an athlete. But there's no evidence that it was ever actually used. But you can imagine, for example, we have one gene for erythropoietin, right? Erythropoietin is a protein we make in the body. Suppose you had multiple copies in your DNA of the erythropoietin gene. Well, you'd put out many more red blood cells, right? So that is prohibited under the general term gene doping. Although we have no evidence that anybody's tried to do it, there certainly is the potential out there to do it. In fact, there are methods that have been developed to try to detect these before they actually become reality. They're trying to stay ahead of the curve because, I mean, think about it. This is a multi-billion-dollar game that people play in the athletic world. There's a lot of money to be made, not just by guys like Prince Fielder, but in cycling, swimming, you name the sport, there's an awful lot of money to be made. And where that is the case, somebody is going to be willing to transfer that technology to the doping world. So with that, let's take a break. Okay. And I want to move on to talk about drug testing. Actually, until the late 1950s, there was no drug testing. Well, there was, of a sort. It was called the sync test, where they, going back for many years, where they would collect sample of urine and then pour it down the sink. In other words, they looked the other way. There was no teeth in it. Some of the sports federations began using drug tests in the late 50s and actually analyzed the contents of the urine. The Olympics in 1968 in the Mexico City Games began testing urine for amphetamines. Then the idea of out-of-competition testing began to take hold in the 1970s and was formalized by many athletic federations. 1983 kind of marked a major point in the history of drug testing. It was the first use of gas chromatography to detect illegal substances or prohibited substances in the urine. Gas chromatography had been around since the 1950s, actually, and it was a good way to determine the presence of substances, even very small amounts of substances, much more sensitive than chemical tests that might be available. And so this was tested first at the Pan Am Games in Caracas in 1983. And the plan was they weren't going to tell anybody that they were going to do this. So the officials arranged for samples of urine to be taken and to be analyzed by gas chromatography. And they kept that under wraps. On the first couple days of the games, many of the athletes were going home. Before even competing, they were going home. And the press started to ask, what's going on here? Well, finally the word got out that some of the athletes were testing positive for drugs like amphetamines. And this was in an environment where people just naturally assumed that you couldn't detect the levels of the drugs, or that nobody cared to look for these drugs, or if they did find them, they looked the other way. And there was a lot of that going on, looking the other way, because countries didn't want to be embarrassed by findings that their athletes were discovered to have drugs, so they might pay a little money under the, a little encouragement under the table to have people manipulate the results. Well, when this started happening and connecting gas chromatography with mass spectrometry really enhanced the sensitivity of the technology there. That a lot of the athletes were discovered to have used illicit drugs, to the extent that the word was getting around pretty fast, and many of the athletes, rather than competing, just went home. They didn't want to be discovered. Then things progressed from there. Now we use gas chromatography or liquid chromatography, LC-MS, or LC-MS-MS, which is an extremely sensitive method for identifying substances in the minutest, almost down to the femtomole level. And radioimmunoassays, ELISA, for example, are routinely used today for detecting substances. And very specifically, methods like LC-MS-MS can be used to separate optical isomers, for example, and detect differences.